I'm going to talk a little bit today and demonstrate later on today about allergy skin testing. It's one of the most important things that the allergist does. To try to figure out is someone allergic and exactly what they're allergic to, we need to do some tests. And the most time-tested, safest, most convenient, and the test that's actually least expensive for patients is to have us do allergy skin testing. We've been doing this for over 100 years. The good news is that in the last 20 years, we've improved it tremendously. We've made it much quicker, much easier, and much less painful. Many people have memories of being allergy tested as a child and remember how terrible they seem to remember that. But in fact, with our newer devices, we basically don't use needles on the back anymore. We use little skin testing devices. We can do it easily, simply, and the patient many times barely feels it. Now again, you're doing something and many children are scared, frightened, and so it's important that we talk them through it, we show them what it's like, and demonstrate just how easy it is. And we can do this in babies, in adolescents, in young adults, in old folks. Any of patients we can do it in, and it's again done easily. We get the results immediately. We'll know within an hour of everything. A patient comes in, whether they're allergic or not, what they're allergic to, and so we can immediately institute therapy. We can recommend avoidance, we can recommend medications, and if they need even allergy immunotherapy or allergy shots. Hey Jamie, so we're gonna put some allergy tests on, like we talked about. We're gonna see what you're still allergic to. It's been a while. And that way we can decide, do we need to think about different medications, what to do about cats or dogs, and especially, do we want to think about allergy shots with the allergies and the asthma? Is that okay?
Yes.
All right. Nurse is going to be in, Linda will be in just a minute. We're going to have you just lie down on the table and she'll put those little scratches on your back.
Okay.
All right? Great.
Here's my hand. Here's the first little pinch. Okay, that's what it's going to feel like. Now the allergy test takes about 10-15 minutes. If your back gets itchy, you can't scratch. Here's a lower one. Sometimes that's a little more sensitive. And then the only other thing, if you set up, just don't lean your back against anything. Okay, back up at the top here. You doing okay?
Yeah. Kind of tickles.
Two more. Okay, last one. Okay. Now I just have some tissue here. I'm just gonna dab these drops off, okay? Okay, so no itching, and if you sit up, just don't lean back.
Okay.
You okay?
Yeah.
Okay, so that is it for the testing.
Things that you're allergic to, the things that you're most allergic to, back here are the grass pollens. Those are the largest reactions. Also, interestingly, to horses. And if you've noticed any problems around horses, you probably don't ride much anymore. But you're also reacting to ragweed pollen, tree pollen, kitty cats, dogs, as we said, rabbits and horses. Not allergic to any foods. And actually the molds aren't as bad, but again, ragweed cats, dogs, dust mites, that's another big one. So you're reacting to both the seasonal and perennial allergens. We may start thinking about allergy shots in the future for you. Any questions that you have?
No.
Okay, well thanks for being a good sport, and I'll come back and we'll talk a bit more.